NHA Free CCMA Practice Quiz. Question 1. While running an EKG, the medical assistant notices a jagged, erratic baseline artifact across all leads caused by patient shivering or tension. Which artifact is this? Option A, wandering baseline. Option B, somatic tremor. Option C, alternating current, AC, interference. Option D, interrupted baseline. The correct answer is option B, somatic tremor. Somatic tremor artifact appears as a jagged, irregular baseline caused by voluntary or involuntary muscle movement, such as shivering, anxiety, or Parkinson's tremor. AC interference produces a uniform 60 cycle per second pattern, while wandering baseline is caused by poor electrode contact or patient breathing. Question 2. Which of the following nutrient classifications provides the highest number of calories per gram? Option A, carbohydrates. Option B, proteins. Option C, fats. Option D, vitamins. The correct answer is option C, fats. Fats provide 9 calories per gram, which is more than double the 4 calories per gram provided by both carbohydrates and proteins. Vitamins are micronutrients and provide no caloric energy. Question 3. A medical assistant is selecting a vein in the antecubital fossa for venipuncture. Which vein is considered the first choice due to its size and stability? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option C, median cubital vein. The median cubital vein is the preferred venipuncture site because it is large, well anchored in subcutaneous tissue, and located away from major arteries and nerves. The basilic vein is a secondary choice but lies near the brachial artery, increasing risk of arterial puncture. Question 4. A medical assistant is participating in a patient-centered medical home, PCMH, model of care. What is a core concept of this healthcare delivery design? Option A, fragmented specialty care focused on acute injuries. Option B, comprehensive, team-based care centered around the patient. Option C, minimizing communication between providers to reduce cost. Option D, prioritizing diagnostic testing over preventative wellness. The correct answer is option B, comprehensive, team-based care centered around the patient. The PCMH model emphasizes comprehensive, coordinated, team-based primary care that is patient-centered and focused on continuity. It integrates preventive care, chronic disease management, and care coordination across all settings to improve outcomes and reduce fragmentation. Question 5. Under the patient's Bill of Rights, patients have a legal right to which of the following? Option A, free medical care regardless of insurance status. Option B, access to and a copy of their own medical records. Option C, guarantees that every treatment will cure their illness. Option D, choice of any specialist without an insurance copay. The correct answer is option B, access to and a copy of their own medical records. Under HIPAA and the patient's Bill of Rights, patients have the right to inspect, review, and receive copies of their own medical records. No law guarantees free care, treatment outcomes, or unrestricted specialist access without insurance network considerations. Question 6. A medical assistant is communicating with a patient who speaks a different language and does not understand English well. What action should be taken? Option A, speak very loudly and use exaggerated hand gestures. Option B, ask a bilingual child accompanying the patient to translate clinical results. Option C, utilize a certified medical interpreter or translation service. Option D, give the patient an English brochure and tell them to read it at home. The correct answer is option C, utilize a certified medical interpreter or translation service. A certified medical interpreter must be used to ensure accurate, confidential communication of clinical information. Using family members, especially minors, as interpreters is prohibited by federal guidelines as it compromises confidentiality and accuracy. Question 7. When applying a surgical dressing to a wound, which of the following layers is intended to be sterile and come into direct contact with the wound bed? Option A, outer elastic wrap. Option B, primary dressing. Option C, secondary tape layer. Option D, ABD pad reinforcement. The correct answer is option B, primary dressing. The primary dressing is the layer placed directly on the wound surface and must be sterile to prevent infection. The secondary dressing overlies it for absorption and protection. The outer wrap provides compression and secures the layers. Question 8. While taking vital signs, the medical assistant observes that the adult patient is experiencing periods of labored breathing and shortness of breath. Which term applies? Option A, apnea. Option B, dyspnea. Option C, eupnea. Option D, orthopnea. The correct answer is option B, dyspnea. Dyspnea is the clinical term for difficulty or labored breathing, often described by patients as shortness of breath. Apnea is complete cessation of breathing, and eupnea refers to normal, effortless breathing. Orthopnea is dyspnea that occurs when lying flat. Question 9. A medical assistant is taking an oral temperature using an electronic thermometer. Where should the probe be placed in the patient's mouth? Option A, on top of the tongue near the front teeth. Option B, under the tongue in the posterior sublingual pocket. Option C, along the side of the cheek opposite the molars. Option D, directly underneath the frenulum near the front gum line. The correct answer is option B, under the tongue in the posterior sublingual pocket. The posterior sublingual pocket, located at the base of the tongue near the frenulum at the back, is richly supplied by the lingual artery and provides the most accurate oral temperature reading. Placement near the front of the mouth is exposed to ambient air and yields inaccurate results. Question 10. A patient performs a clean catch midstream urine specimen collection. What is the purpose of instructing the patient to void a small amount into the toilet first? Option A, to clear the urethra of external skin flora and contaminants. Option B, to reduce the total volume of the urine specimen. Option C, to test the flow rate of the urinary bladder. Option D, to ensure that the urine collected is from the kidneys only. The correct answer is option A, to clear the urethra of external skin flora and contaminants. The initial stream of urine flushes external urethral meatal flora and contaminants from the distal urethra. The midstream portion that follows is less likely to be contaminated, providing a more accurate culture result. Volume reduction is not a clinical goal. Question 11. A medical assistant is preparing to autoclave surgical instruments. Which of the following indicators ensures that the sterilization parameters of time, steam, and temperature were met? Option A, autoclave tape color change. Option B, chemical indicator strip inside the pack. Option C, the pressure gauge reading 15 psi. Option D, the water level inside the reservoir. The correct answer is option B, chemical indicator strip inside the pack. An internal chemical indicator strip placed inside the pack is the most reliable indicator that sterilization conditions were met throughout the entire pack. External autoclave tape only confirms the pack was exposed to heat, not that internal contents were sterilized. Question 12. A 6-month-old infant is brought to the clinic for a well child checkup. How should the medical assistant measure the infant's length? Option A, hold the infant upright against a wall-mounted tape measure. Option B, place the infant supine on a measuring board and extend the legs fully. Option C, wrap a flexible tape measure around the infant's torso and limbs. Option D, mark the paper on the exam table at the crown and heel while the infant is prone. The correct answer is option B. Place the infant supine on a measuring board and extend the legs fully. Infants under 2 years are measured in the recumbent, supine, Position using an infant measuring board to ensure full extension of the legs. Standing height is measured only once the child can stand steadily, typically after age 2. Question 13. A healthcare provider performs an invasive procedure on a competent patient without obtaining their signature on an informed consent form. What legal charge could apply? Option A, battery. Option B, negligence. Option C, defamation. Option D, fraud. The correct answer is option A, battery. Battery is the intentional, unlawful touching of another person without consent. Performing an invasive procedure without informed consent constitutes battery, even if no harm results. Negligence involves a breach of duty resulting in harm, which is a different standard. Question 14. A medical assistant performs a urine chemical screening using a reagent strip. Which of the following parameters, if positive, indicates a probable urinary tract infection? Option A, ketones and glucose. Option B, leukocyte esterase and nitrites. Option C, bilirubin and urobilinogen. Option D, specific gravity and pH. The correct answer is option B, leukocyte esterase and nitrites. Leukocyte esterase indicates the presence of white blood cells, pyuria, and nitrites are produced when bacteria convert urinary nitrates, both strongly suggesting a UTI. Ketones indicate fat metabolism or fasting, and glucose suggests hyperglycemia, not infection. Question 15. A medical assistant is managing electronic health records, EHR. Which of the following functions allows the electronic transfer of prescriptions directly to a pharmacy? Option A, practice management billing. Option B, CPOE, computerized provider order entry. Option C, automated clearinghouse transfer. Option D, patient portal messaging. The correct answer is option B, CPOE, computerized provider order entry. CPOE enables providers to electronically enter and transmit medication orders, including prescriptions, directly to pharmacies or hospital dispensing systems. This reduces transcription errors and improves medication safety compared to handwritten or verbally communicated prescriptions. Question 16. A medical assistant observes that a hematoma is beginning to form rapidly during a venipuncture. What should be the assistant's immediate action? Option A, adjust the depth of the needle to stop the bleeding. Option B, advance the needle further into the vein. Option C, remove the tourniquet, withdraw the needle, and apply pressure. Option D, have the patient pump their fist to redistribute the blood. The correct answer is option C, remove the tourniquet, withdraw the needle, and apply pressure. Hematoma formation indicates blood is leaking into surrounding tissue, likely because the needle has exited the vein. The correct response is to release the tourniquet immediately, withdraw the needle, and apply firm pressure to minimize bruising. Advancing the needle worsens the injury. Question 17. Which document provides instructions regarding a patient's preferences for medical treatments, such as mechanical ventilation or tube feeding, if they become incapacitated? Option A, healthcare proxy. Option B, informed consent form. Option C, living will. Option D, durable power of attorney for finances. The correct answer is option C, living will. A living will is a legal advance directive that specifies a patient's wishes for life-sustaining treatments should they become unable to communicate. A healthcare proxy designates a person to make decisions, while a durable power of attorney for finances covers financial matters only. Question 18. A medical assistant notes a prescription for a Schedule II controlled substance. Which of the following is a characteristic of Schedule II drugs? Option A, they have no accepted medical use in the United States. Option B, they have a high potential for abuse but are accepted for medical treatment. Option C, they can be refilled up to 5 times within a 6-month period via phone. Option D, they carry a very low risk of physical or psychological dependence. The correct answer is option B. They have a high potential for abuse but are accepted for medical treatment. Schedule II drugs have a high abuse potential with severe psychological or physical dependence risk, yet are accepted for medical use with strict prescribing controls. Schedule I drugs have no accepted medical use. Schedule II prescriptions cannot be called in by phone or refilled. Question 19. A medical assistant notices an administrative error where a colleague changed a patient's chart entry to justify an insurance payout. This action constitutes which of the following? Option A, malpractice. Option B, misfeasance. Option C, fraud. Option D, assault. The correct answer is option C, fraud. Deliberately falsifying medical records to obtain payment constitutes healthcare fraud, a federal crime under the False Claims Act. Malpractice involves professional negligence resulting in harm, while misfeasance is the improper performance of a lawful act. Question 20. A medical assistant is performing ear irrigation to remove impacted cerumen. Where should the stream of warm solution be directed? Option A, directly at the center of the tympanic membrane. Option B, toward the top or side of the ear canal wall. Option C, toward the floor of the external auditory meatus. Option D, at the opening of the eustachian tube. The correct answer is option B, toward the top or side of the ear canal wall. The solution should be directed toward the upper or posterior wall of the ear canal, not directly at the tympanic membrane, to allow it to flow behind the cerumen and flush it outward. Direct pressure on the tympanic membrane can cause pain or perforation.